This medication is used to relieve dry, irritated eyes. Common causes for dry eyes include wind, sun, heating/air conditioning, computer use/reading, and certain medications. This product may contain one or more of the following ingredients: carboxymethylcellulose, dextran, glycerin, hypromellose, polyethylene glycol 400, PEG 400, polysorbate, polyvinyl alcohol, povidone, or propylene glycol, among others. Eye lubricants keep the eye moist, help to protect the eye from injury and infection, and decrease symptoms of dry eyes such as burning, itching, and feeling as if something is in the eye. It is recommended to use this medication as directed by your doctor. The typical dosage is 1 to 2 drops in the affected eyes as needed. It is best to use the drops at evenly spaced intervals throughout the day. When using PEG 400-Propylene Glycol drops, it's important to follow the directions on the product package. If you have any questions, it's best to consult your doctor or pharmacist. It's important not to use a solution that has changed color or is cloudy, although some brands may have a milky appearance, which is okay as long as the solution does not change color. Some eye drops need to be shaken before use, so be sure to check the label. For drops, they may be used as often as needed, while ointments are usually used 1 to 2 times daily as needed. If using an ointment once a day, it may be best to use it at bedtime. When applying eye ointment or drops, be sure to wash your hands first. Avoid touching the dropper or top of the ointment tube to prevent contamination. Remember to always replace the cap tightly after each use. Tilt your head back, look up, and pull down the lower eyelid to make a pouch. For drops or gels, place the dropper directly over the eye and squeeze out 1 or 2 drops as needed. Look down and gently close your eye for 1 or 2 minutes. If using ointment, hold the tube directly over the eye and gently squeeze a small strip into the pouch. Blot away any extra ointment from around the eye with a clean tissue. If you are also using another kind of eye medication, wait at least 5 minutes before applying other medications. Use eye drops before eye ointments to allow the eye drops to enter the eye. If you wear contact lenses, it's important to remove them before using most kinds of eye lubricants. Be sure to ask your doctor or pharmacist when you may replace your contact lenses. If your condition lasts or gets worse after 3 days, it's important to inform your doctor. When you first start using PEG 400-Propylene Glycol drops, you may experience temporary blurred vision and minor burning, stinging, or irritation. If these effects persist or worsen, it's important to notify your doctor or pharmacist right away. If your doctor has prescribed this medication for you, it's because they have determined that the benefits outweigh the potential risks of side effects. Most people using this medication do not experience serious side effects. However, it's crucial to seek medical attention if you experience any serious side effects, such as eye pain, changes in vision, or continued redness and irritation in the eyes. While rare, a severe allergic reaction to this medication can occur. Seek immediate medical help if you notice symptoms such as rash, swelling, severe dizziness, or difficulty breathing. It's important to note that this is not a complete list of possible side effects. If you notice any other effects not mentioned here, be sure to contact your doctor or pharmacist. If you're in the US, you can call your doctor for medical advice about side effects, or report them to the FDA at 1-800-FDA-1088 or www.fda.gov/medwatch. In Canada, you can call your doctor for medical advice about side effects, or report them to Health Canada at 1-866-234-2345. Before using PEG 400-Propylene Glycol drops, make sure to inform your doctor or pharmacist about any allergies you may have. This product may contain inactive ingredients that can cause allergic reactions or other issues. It's important to consult with your doctor or pharmacist if you have any health problems before using this product. After applying the drops, you may experience temporary blurred vision. It's important not to drive, use machinery, or do any activity that requires clear vision until your vision has returned to normal. It's important to be aware of potential drug interactions that may affect how your medications work or increase your risk for serious side effects. Make sure to keep a list of all the products you use, including prescription and non-prescription drugs, as well as herbal products, and share it with your doctor and pharmacist. Always consult your doctor before starting, stopping, or changing the dosage of any medicines. This will help ensure your safety and the effectiveness of your medication regimen. If this medication is accidentally ingested, it can be harmful. If someone has taken too much and experiences severe symptoms like fainting or difficulty breathing, it's important to seek immediate medical attention by calling 911 or the local poison control center. In the U.S., residents can contact their local poison control center at 1-800-222-1222, while Canadian residents can reach out to a provincial poison control center. Always keep this medication out of reach of children and pets to avoid accidental ingestion. When using PEG 400-Propylene Glycol drops, it's important to be aware that some products may contain preservatives that could potentially harm contact lenses or cause irritation for those with allergies. It's recommended to check the product package for more detailed information, or speak with your healthcare provider if you have any concerns. As always, it's important to follow the recommended dosage and timing for optimal results. When using PEG 400-Propylene Glycol drops, it is typically used on an as-needed basis. It is important to follow the instructions provided by your healthcare professional for the best results. Make sure to check the storage information on the package and protect the drops from freezing. Some preservative-free drops that come in single-use vials or droppers should be discarded immediately after use or up to 12 hours after opening. Be sure to check the product package to see when you should discard your preservative-free product. It's important to keep all medications away from children and pets. Do not flush medications down the toilet or pour them into a drain unless instructed to do so. Make sure to properly discard this product and it is expired or no longer needed. If you have any questions about storage or disposal, ask your pharmacist for guidance. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.